welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and here is what I bring to you all from the world of medicine. What differences between sexes play a major role in the cancer susceptibility of men versus women? Rates of most types of cancer are usually higher in men than in women for reasons that are still quite unclear. Now, the results from a recent study that was published in the Cancer Journal suggest that the cause may be underlying biological sex differences rather than behavioral differences related to smoking, alcohol use, diet, and various other factors. To investigate further, the researchers assessed differences in cancer risk among close to 171 males and 122 females, adults who were aged 50 to 71 years. The incidence was much lower in men than women only for thyroid and the gallbladder cancers, and the risks were higher in men than women at other anatomic sites. Now, the greatest increased risks in men were seen for esophageal cancer, larynx, the gastric cardia, as well as the bladder cancer. Now, men had an increased risk of most cancers even after adjusting for a wide range of risk behaviors as well as carcinogenic exposures. Hence, the findings did suggest that biological differences between sexes, such as physiological, immunological, genetic, and various other types of differences, all play a major role in the cancer susceptibility of men versus women. So, the authors hence concluded that there are differences in cancer incidence that are not explained by environmental exposures alone. This suggests that there are intrinsic biological differences between men and women that affect their susceptibility to develop cancer. An artificial intelligence tool that was designed to speed critical information on drug overdose deaths. According to a new UCLA research, an automated process based on computer algorithms that can actually read texts from medical examiners' death certificates can substantially speed up the data collection of overdose deaths, which in turn can ensure a more rapid public health response time than the system currently that is in use. Now, the analysis is published in the JAMA Network Open. It used tools from artificial intelligence to rapidly identify substances that caused this overdose deaths. So, as it now stands, overdose data recording involves several steps, beginning with medical examiners and coroners who actually determine the cause of death and record the suspected drug overdoses on death certificates, including the drugs that were involved in causing the death. Now, these certificates are then sent to local jurisdictions or the CDC, which actually code them. Now, this coding process is very time consuming as it may be done manually also. So, as a result, there is a substantial lag time between the date of death and the reporting of those deaths, which actually slows the release of the surveillance data. Now, this in turn actually slows the public health response. So, for this study, the researchers used a natural language processing and a machine learning tool to analyze nearly 35,000 death records, and they found that around 8,700 overdose deaths recorded. The most common specific substances were fentanyl, alcohol, cocaine, methamphetamine, heroin, prescription opioids, and any benzodiazepines. So, the researchers highlighted that if these algorithms were embedded within the medical examiner's offices, the time could be very much reduced to as early as toxicology testing is completed, which could be about 3 weeks after the death. How aldosterone is linked to an increased risk of chronic kidney disease progression and end-stage kidney disease. So, a steroid hormone called the aldosterone is linked to an increased risk of kidney failure in patients who are suffering with chronic kidney disease. This is in accordance to a study that was published in the European Heart Journal. The findings of this study are very important because of the fact that they suggest that aldosterone, it plays a role in the progression not only of chronic kidney disease but also for heart and blood vessel problems, and that an existing drug that targets the action of aldosterone may actually help to prevent the chronic kidney disease from getting worse. So, the researchers investigated the associations between aldosterone concentrations in the blood and kidney disease progression close to among 3,600 participants in the chronic renal insufficiency cohort study. They focused on the CKD progression, which was defined as a 50% decline in the ability of the kidneys to actually filter the blood through the glomerular blood vessels. They followed the patients for an average of nearly 10 years. So during this time, the CKD progression occurred in 38% of the participants. They also found that the higher aldosterone concentrations were associated with lower EGFR, lower levels of potassium in the blood, as well as higher potassium and protein concentrations in the urine. So after adjusting for factors that could actually affect the results, such as medications, other medical conditions, the age, race, height and weight, they found that each doubling dosage of aldosterone concentrations in the blood was linked to 11% increased risk of CKD progression. Therefore, it was concluded that these findings are important as they suggest that higher concentrations of aldosterone may play a major role in CKD progression as well as cardiovascular disease in patients with chronic kidney disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.